This resource on Medicare supplement policies is being made available by Senior American Insurance Agency and 65medcareinfo.com. Telephone support is available at 800-332-7557 from 8 a.m. to 3:30 p.m. Eastern Standard. Some of the reasons why a person might choose a Medicare supplement policy over a Medicare Advantage plan. First of all, you can get a very comprehensive health care policy when you choose original Medicare with a Medicare supplement policy, leaving in some cases no out-of-pocket expenses. You can budget your health care expenses on a monthly or annual basis. With a Medicare Advantage plan, you're typically paying a copayment on a service-to-service basis, so you never really know what your out-of-pocket expenses might be. With Medicare Original and a Medicare supplement policy, you can go to any doctor and any hospital in the country. When you're in a Medicare Advantage plan, you might have to deal with networks, you might have to get referrals to go to specialists or pre-authorization for tests. You can never be canceled with a Medicare supplement policy because of your age or your health, and the policies do not change. With Medicare Advantage plans, they send you an annual notice of change each year, and then you have to decide if you want those benefits or if you want to choose another plan. Medicare supplement policies typically do not change from year to year. So those are just some of the reasons why a person might choose a Medicare supplement policy. Before we can look at the Medicare supplement policy specific benefits, we first have to examine Part A and B of Medicare because that would be the primary insurance. This chart represents Part A of Medicare, and there's 3 columns on the page. The left-hand column is the type of service that you might get. The center column is what Medicare itself pays for, and the right-hand column is what you're responsible for. Those are the items that you can defer over to your Medicare supplement. On the far right, it shows here what your Medicare supplement can cover. So these are the specific areas that can be covered by the Medicare supplement policy: the Part A deductible, the basic benefits, and the skilled nursing. Those are the 3 that correspond to the Part A benefits. So we're going to look at those 3 items. If you're hospitalized under Medicare, Medicare itself pays most of the confinement costs. Either you or your insurance has to pay the Part A deductible. The Part A deductible for the year 2012 is $1,156. If you have a Medicare supplement policy and it has the Part A deductible benefit within it, that will pay that for you, and then that will defer the cost over to the Medicare supplement. The middle section here in the green is what's considered basic benefits, and what would be covered under that would be a loose term called extended hospital. It would be if you were hospitalized longer than 60 days, between days 61 to 90, there's so much per day out of pocket that Medicare does not cover, and the lifetime reserve days are between 91 to 150. There's so much per day that's left over there. And after 150 days, Medicare pays nothing. If you have the basic benefits, which all Medicare supplement policies do, that will cover those out-of-pocket expenses, and you can see $8,000, $34,000. So your Medicare supplement can cover some large extended hospital bills for you. The last column is the skilled nursing benefit, and this was if you're confined to a skilled nursing facility. As you can see, Medicare covers the first 20 days at 100%. So if you're in there for less than 20 days, Medicare will cover the whole shot. Medicare will pay for an additional 80 days, but during those days, Medicare falls short by $144.50 per day. That could add up to as much as $11,560. So if you have this skilled nursing co-insurance benefit within your Medicare supplement policy, that will cover those additional 80 days that Medicare leaves there, or that Medicare falls short. So those are the 3 items that are important under the Part A of Medicare. The Part A deductible covers the Part A deductible. The basic benefits cover the extended hospital days, and the skilled nursing benefit covers the 80 days that Medicare falls short. That's a brief look at Part A Medicare, and next we'll examine Part B Medicare. We'll take a brief look at Part B of Medicare. Part B is fairly straightforward. Medicare pays 80% of the approved amount of the medical services under Part B, and either you or your insurance has to cover the other 20%. That's why people want a Medicare supplement policy to cover 20%, because that 20% can add up to a lot of money in those medical expenses. Before Medicare begins to pay their 80%, either you or your insurance has to meet what they call the Part B deductible. The Part B deductible does fluctuate in the year 2012, it was $140. The other item that's important under Part B Medicare is blood. Medicare pays after the first 3 pints of blood. Either you or your insurance has to cover the first 3 pints of blood. So if you have a Medicare supplement policy, the 20% and the first 3 pints are under the green color scheme or the basic benefits. So all Medicare supplement policies have to cover those 2 items, the 20% and the first 3 pints of blood. We'll get into the specific plan benefits in just a moment. Medicare supplement policies are standard in most states. They're designated by letter, Plan A right on through Plan N. The way it works is what's listed underneath the letter of the plan is what's covered underneath that plan. Now we've been looking at 3 color schemes, the green or the basic benefit color scheme, the pink or the Part A deductible benefit, and the skilled nursing coinsurance in the purple. Those are the 3 that our clients tell us they want covered under their Medicare supplement policy. We feel that Plan C, Plan D, Plan F, Plan G, and Plan N do those very effectively because they list all 3 of those primary benefits. Plans K, L, and M are reduced benefits. They do have asterisks, and we don't have time to delve into how they get reduced, but they do pay a reduced amount on the basic benefits, the Part A deductible, the skilled nursing, in some or in all 3. There's a couple of plans cover the Part B deductible, a couple of plans cover excess charges. There's foreign travel in a few of these plans, and because of the reduced payments in K and L, they do have out-of-pocket maximums. We encourage you to attend one of our product webinars on Medicare supplement policies, and we can take a little bit more time to break down where each individual policy and what policies we feel are effective. Again, we highly recommend Plan F and Plan N. We can't give quotes because of the difference in state, even county, and zip code differentials in premium. So we would love to give you a quote, attend one of our product webinars, and we can quote you on, again, we like Plan F and we recommend highly Plan N. We just talked about the fact that we typically recommend Plan N, and we recommend Plan F as well. This chart is just a hypothetical situation, a healthcare scenario of a stay in the hospital, 23 days in skilled nursing, and how those benefits would work out if a person had just original Medicare, if they had Plan N, and if they had Plan F. Well, the person with original Medicare would have to pay the Part A deductible, $1,156. Plan N and F would cover those items. In skilled nursing, Medicare would pay for the first 20 days. So if there was 3 additional days, the person with original Medicare would have to pay another $433.50. The person with Plan N or F would pay nothing. The Part B deductible, again, original Medicare, the person would have to meet that. The person with Plan N would have to meet the $140 Part B deductible. The person with Plan F would be covered under their insurance. And we're 2 fictional co-insurances for doctor visits. The 20% we're saying added up to $40 for the person in original Medicare, $2 $20 co-payments for the person in Plan N, 0 for the Plan F. So with the total scenario, a hospital stay, 23 days in a skilled nursing facility, and 2 doctor visits, the person with original Medicare only had to pay out of pocket $1,769.50. The person with Plan N paid $180 for that scenario, and the person with Plan F paid nothing. So you can see we like Plan N and we like Plan F because they cover the large bills like the inpatient hospital and the skilled nursing fully. You might have some smaller out-of-pocket expenses with Plan N. Plan F basically covers whatever Medicare doesn't. So that's just a quick scenario on a hypothetical hospital stay, skilled nursing stay, and doctor visits, and what a person would pay out of pocket with original Medicare, with Plan N, and with Plan F. A couple points to remember for people coming into Medicare as they're turning 65 and looking for a Medicare supplement policy to start. People entering in during their initial enrollment period, the 3 months before, the month of, or the 3 months after, are guaranteed issue with Medicare supplement policies. So that means there's no medical questions and all your conditions are covered even if they're pre-existing. Policies are guaranteed renewable for life, so they can never cancel you because of your age or your health, and companies are offering very competitive pricing for new Medicare enrollees. Many people are coming from group insurances or spousal group insurances, and they want those people in a Medicare supplement, so they're offering very competitive pricing. There's not even a rate up for smokers because of the guaranteed issue aspect. So those are just a few things to remember for people coming into Medicare for the first time and looking for a Medicare supplement policy. I hope you have a better understanding of how Medicare supplement policies work with Original Medicare after watching this video. We welcome you to continue to use our website, 65medicareinfo.com, to continue your education. Watch some of the other videos that we've prepared, the Medicare Basics video, the Medicare Advantage video, and the 2 ways to get your Medicare video. These will put you well on your way to using our simplified Medicare decision-making formula. You're doing the first part right now, get educated. The second step would be decide Original Medicare or Medicare Advantage, and then the third thing would be to find the plan that fits your individual healthcare needs, your lifestyle, and your budget. We can help you do that again by joining one of our online webinars. This will allow you to ask questions with other people, or if you want to do an individual webinar, we can even do it one-on-one. You can get a health coach to walk you through your individual circumstances so that you can use that formula to your best interest. If you just want to look at a quote, certainly call us 800-332-7557 every business day, 8 a.m. to 3:30 Eastern Standard. You can email us for a quote at quote@65medicareinfo.com. Anytime that you're stuck and you need help, just give us an email at help@65medicareinfo.com. Now, if you're looking for a quote specifically on Medicare supplement policies, make sure to include your state, your zip code, and your county that you live in, because those are parameters that we would need to give you the most accurate information. Thanks for tuning in today. You continue to use our website, call us, or email us for any further correspondence. Thanks for tuning in.